Welcome back. We're going to take you back to one of our top stories tonight. Earlier we heard about those shocking new NHS figures, with records being broken for hospital waiting lists, A&E attendances and ambulance call-outs all going in the wrong direction. So how does it affect those working on the front line? Delighted to say we're joined now by Dr Ian Higginson, who's the Vice President of the Royal College of Emergency Medicine, and by Rory O'Connor from the College of Paramedics. Gentlemen, thank you so much for both joining us on 5 News tonight. Ian, let's come to you first of all. I know you've been qualified for over 30 years. How does what you are seeing and what the staff that you're working with seeing at the moment, how does that compare with the time that you've spent in medicine?
So I think at the moment we're under pressure as I've never seen it before, and we are struggling more than I've ever seen it before. So you asked, have I ever seen it this bad? And the answer is honestly no.
And give us an idea of what life is like on the front line at the moment. What sort of pressures are you facing every day?
So, as you know, emergency service have been hit by a combination of factors, and I think we're feeling a bit battered, really. We are feeling rather overwhelmed by the numbers of very sick patients that are seeking our care, and really upset by the lack of ability to deliver the sort of care we would like to deliver, because our emergency departments are full to bursting. We're having to hold ambulances in our car parks. We know that patients are waiting a long time to get those ambulances in the first places. And it means basically we can't deliver the care that we know we can deliver if we have the tools to do our job. And we find that very upsetting, both for our patients and for ourselves as staff members.
And Rory, are you feeling that same frustration and not being able to do the job as well as you would like to do it? And is the pressure hitting the paramedics as well in the same way?
Yeah, we're feeling exactly the same pressure that the EDs are feeling. So as paramedics, frontline paramedics, the real concern is our staff being upset, just as Dr Higginson's staff are upset that they can't deliver the quality of care they want to. And we're stuck queuing outside A&Es. You know, it's a very frustrating experience, whereas previously you'd maybe see 6 or 7 patients on a shift. You're maybe now seeing only 1 or 2. And it's that frustration at not being able to deliver the level of care you would like, and the impact and the risk that has then in the community, because we're holding patients in the community, and the risk of those patients that are unseen by anybody is quite high, and it's a very frustrating and disheartening place to be in.
Rory, I've got a little sister who works as a nurse in the NHS, and when I speak to her and I speak to some of her colleagues and other people I know who work in those departments, they all say that it's hard because they're under so much pressure at the moment, but also there's that legacy of what they've all been through with the pandemic and the mental health issues that are still there in the medical staff on the back of that.
Yeah, I don't think we can underestimate what I would call the moral injury that staff have suffered over the last 2 years, the stress of 2 years of a pandemic, the ever increasing workload, you know, the impact it has on staff morale, you know, looking at our workforce. It is just like talking to colleagues, experiencing it myself. It is really significant, and we are having lots of staff coming forward, and it's reflected in our workforce where we're struggling with retention. We're struggling to retain clinical paramedics in frontline roles because it's such a stressful job, and it has such an impact on your life, and you're asking people that have gone to the well over and over again to keep going back to the well and keeping a service afloat, and it's very difficult for frontline staff.
It's interesting you talked about retention there, because that was something I wanted to speak to Ian about. I recently took one of our daughters to an A&E department, and they were struggling with staff numbers because some had left, because some were struggling with COVID. And we went early in the morning. There was just one doctor on, and somewhere between a 4 and 5 hour wait. Is that adding to that pressure as well, the staff who are leaving and trying to come through a pandemic as well?
Yeah, unquestionably. So we hear lots about, it's quite common for, particularly for political leaders to say we're going to recruit these many more staff. But what we're not doing is we're not keeping hold of the highly skilled and experienced staff that we have for a number of reasons. Some of those are due to the pressures that Rory has described. Some of those are because those who are left when others, those who remain when others have left, feel even more strain. Some of those are due to issues around the NHS pension scheme for more senior doctors. There's all sorts of things that contribute to staff choosing to take their experience elsewhere or choosing to leave the NHS, which is desperately sad. These are highly skilled, highly committed staff who often feel they simply can't carry on. And I think that the final frustration I suspect that we share is that we don't see what we feel and what we know and what patients experience. We don't see that reflected in the discussions at high level about where the NHS is. It feels like there's a disconnect between the reality on the front line and what is being spoken about more centrally. And I think what we'd all like to see in the first instance is a recognition that there really is a problem in the NHS at the moment. This isn't a COVID thing, a pure COVID thing. This is a long-standing resource and workforce issue that has really come back to bite us in a big way. And unless we get to grips with it, it's going to keep on doing that.
Well, it's fascinating to hear you both. And Ian, I don't know whether you can see Rory. Rory's nodding along with everything that you're saying. And, you know, I was going to ask the pair of you whether you think it's going to get worse. But, Ian, you basically alluded to that. And, of course, Rory, there's this heat wave at the moment as well. There's lots of medical warnings with regards to that. I imagine that just adds extra pressure at the moment.
Yeah, it really does. And just to emphasise what Ian said, so COVID is an impact, but we're talking about a system that doesn't have a lot of slack. And once there's any pressure put on it, it just struggles to cope. So COVID's an impact, the heat wave's an impact, anything that we can't expect or any new event just puts extra pressure on a system where there's just not a lot of slack. And we're seeing the same issues with ambulance services. So we're struggling to retain clinical staff because it's just so stressful. You know, I talked to colleagues recently who'd done a 15-hour shift without a break in an ambulance, you know, so 15 hours without stopping. And that's the reality. That's what staff are facing on a day-to-day basis. And it's not sustainable, unfortunately.
Well, thank you so much for the pair of you for joining us tonight. Rory O'Connor from the College of Paramedics and Dr Ian Higginson, the Vice President of the Royal College of Emergency Medicine. Appreciate your honesty with us this evening on 5 News, and thank you for your hard work as well.